Hello, and welcome back to PI Today podcast. We have a very special guest, Dr. Chadwick J. Donaldson, who is an ENT doctor here in lovely San Diego. Doctor, welcome.
Thank you. Thank you for having me.
Of course. What a beautiful town you practice in. You're
It
making
is
all these
gorgeous.
doctors nationally very jealous that you're sitting here right on the beach and having a podcast. So, Doc, tell us a little bit about your education, your ear, nose, and throat. Tell us how you become that way.
I started medical school in New Orleans, Tulane University of New Orleans. I did a master's in genetics as well at LSU at the same time. I did my residency at Navy Medical Center San Diego. We did 6 years of residency there. I was in the Navy for 16 years, and for the entire time I was attached to the Marine Corps. Traveled with them to Iraq, spent 7 months deployed in Ramadi at the time of the Battle of Fallujah. I came back here, and once I got out of the Navy, I opened a practice in Hillcrest, San Diego, and I do pretty much comprehensive ear, nose, and throat, anything and everything. So,
Well, first and foremost, thank you for your service and
thank you.
dedication and hard work to this beautiful country. Secondly, there is a special need in the personal injury world for ENTs. A lot of people, patients, attorneys, they really don't know what the specialty is. What do they do? So when it comes to the personal injury world, as we talked earlier, one of the specific things you guys deal with is ear issues, and in traumatic brain injuries and TBIs, if they've been struck or an explosion or something's happened, you would be the doctor if they have ringing in their ears. What type of symptoms do you treat?
So, as an ENT, we typically treat anything related to the ears. We see a lot of dizziness. We see a lot of tinnitus or tinnitus. We see hearing loss from trauma. We do sometimes headaches associated with traumatic brain injury or concussions and chronic headaches. So we're very comprehensive in that regard. And we do all the other stuff for ENT, thyroids and sinus surgery, sleep medicine, TMJ in some cases. But as far as the ears are concerned, it's whatever injury occurs in the ears, in the brain, and how it affects the ears or how it affects the perception of what's going on, we address. Some people will have a brain injury and all of a sudden their ears are sensitive to everything. And, they call that hyperacusis, where they can't, sounds make them very, very sensitive. They can't function. They can't be in part of society, with normal noise. And we treat that as well. So,
Right. And what about orbital fractures and all the nasty stuff
so
that
I,
happens
so I,
out
w-
there?
I was trained in the Navy where, we take on orbital fractures, jaw fractures, sinus fractures, and all of those are fair game. Nasal fractures. So, all of that we do, and I still do today on a regular basis.
That's great. So in our world, obviously we have from motorcycles to high impact to pedestrians, we get all of the above. You mentioned something earlier. The sooner you get to the patient and treatment, the better. So tell me a little bit about that.
In regards to TBI therapy, a lot of times patients have what they call acute brain injury, and then they have sort of a delayed brain injury where they have that post-concussive symptomology, headaches associated with that. And the earlier you can get a patient in and get them treated and started on treatment, whether it be vestibular therapy, treatment of the brain injury itself, making sure that the hearing is affected, and specifically treated if they need steroids for the hearing loss, the better the prognosis for the patient. the better the long-term sequelae for the patient. If you delay and 6 to 9 months later you're seeing this patient, oftentimes things have sort of set themselves off into sort of a stable chronic issue, and it's hard to get them back. So you want to treat them more acutely than you do in the delayed standpoint.
Excellent. And what are your locations that you have?
So currently I have a location in Hillcrest, San Diego.
Got it.
And then by next year we'll actually open another location on Miramar Road, which is more north and near the Marine base. And so
Top Gun.
Top Gun.
When you say Miramar,
that's
I think
exactly
of Top
right.
Gun. That's right. Okay.
Yeah. So.
All right. That's lovely. And where do you do your surgeries?
So I'm on staff almost everywhere. So I have a surgery center that I'm a part of. I'm at all the Sharps,
Wonderful.
all of the Scripps, except for Scripps Green, but every other script I'm on. I do it at UCSD as well.
Wonderful.
So fairly, if you're in San Diego and your insurance is tied to a specific center, or you're close or live near a specific center, I'm probably on staff there.
That's fantastic, Doc. Well, thank you for joining us today. Thank you for telling us about your specialty. I know you're a busy guy. Thank you for taking time. We'd love to have you back on the show and come back to San Diego. So thank you very much.
Thanks, Dr. Nick. I appreciate it.
Thank you, Doctor. There you have it, direct from San Diego. An ENT doctor, Dr. Donaldson, hell of a guy. And you know his locations.
I have many leather-bound books.
Nice, very nice. many leather-bound books. All right, guys, tune in next time. Take care. Bye.
Thanks for listening, PI Today podcast, sponsored by Trauma Cash, Global Lean Doctors and TBI Analytics. You can find us on our website, www.pi2daypodcast.com, also on Instagram, YouTube, Spotify, TikTok, and LinkedIn as PI 2 Day Podcast to watch all our episodes. See you next time.